You think you're resting. You close your eyes, breathe deeply, and finally surrender to the comfort of your bed, hoping your body will recharge. But while you sleep, something else is happening, something silent, something invisible, and it might be the real reason why you wake up tired, with your throat burning, a cough that doesn't go away, or a strange bitterness in your mouth that no toothpaste can erase. This isn't just about sleep quality. It's about something much deeper and more dangerous. Your own stomach slowly sabotaging you night after night, and you don't even know it's happening. If this content helped you understand what your body has been trying to tell you every night, subscribe now. And tell me in the comments, which side do you usually sleep on? The truth is, your body isn't built to fight back while asleep. When you're awake, you swallow frequently. Your saliva helps neutralize acid, and your body stays alert to discomfort. But the moment you fall into deep sleep, your defenses shut down. And if you suffer from acid reflux, even just occasionally, the damage begins the moment your head hits the pillow. Most people associate acid reflux with that sharp, burning sensation behind the chest or the sour taste after a heavy meal. But what happens during the night is a different beast. It doesn't always burn. It doesn't always wake you up. Sometimes it works silently, a slow creep of acid up the esophagus, reaching areas that were never meant to handle it: your throat, your vocal cords, even your lungs. Over time, this creates a chain reaction that many mistake for something else entirely. Have you ever woken up with a dry cough, even though you don't have a cold? Do you feel like clearing your throat in the morning, like there's something stuck there, but nothing ever comes out? That's not allergy. That's not age. That's your body reacting to the acid that spent the night rising while you were completely unaware. There's a name for this. It's called silent reflux, and it affects millions, especially people over 50. And the worst part? Most of them are never diagnosed. Instead, they're given cough syrup, allergy pills, or even asthma medication, when the real cause is quietly rising up the throat every single night. And every night, it gets worse. One study published in the American Journal of Gastroenterology showed that nearly 75% of people with reflux symptoms experience them at night. But what they don't realize is that nighttime reflux causes more damage than daytime reflux. Why? Because it lingers. The acid stays in contact with your esophagus and throat for longer. Your body doesn't have the same reflexes to push it back down. And while you sleep, you're not upright. You're horizontal, making it even easier for gravity to work against you. Now imagine this happening every night. Not just once, not just after pizza or that second cup of coffee, but every single night, for years. That constant exposure can lead to inflammation, ulcers in the throat, chronic hoarseness, and even precancerous changes in the esophagus, something called Barrett's esophagus, a condition that increases the risk of esophageal cancer. And yet, it all begins so small. A little burn after dinner, a cough that appears out of nowhere, a tickle in your throat when you wake up, and we ignore it because we think it's nothing. We think it's age, or maybe the air is dry, or we just slept with our mouth open. But ask yourself this: how long have you had these symptoms? Weeks? Months? Years? People often change their diets, take antacids, even start medications, but they still suffer. Why? Because no one told them that the real enemy isn't what they eat, but how they sleep. Your sleep position is not just a preference. It can be a trigger, a trap, an accelerator of silent damage that, over time, robs your voice, your energy, your health. And the position most people choose, the one we think is most natural, most relaxing, is often the one that makes everything worse. It's like going to bed next to a leaking faucet, and every night that leak gets bigger. You don't hear it, you don't see it, but every morning the floor is wetter. Every morning the symptoms are stronger. And still, you think it's just part of aging. Let's be clear. Reflux is not just about heartburn, and it's not just about food. It's about pressure, position, gravity, and whether your body, while sleeping, is in a state of defense or surrender. Some people even wake up choking or gasping for air, completely unaware that acid has reached their windpipe. Others start developing breathing issues and never connect the dots to reflux. And that's the scary part, because the signs are there, but subtle. And if you're not looking for them, you miss them. And your doctor might miss them too. Think about how many medications you've tried, how many mornings you've coughed, cleared your throat, or blamed your pillow for your discomfort. What if the answer isn't in a pill, but in your pillow's position? What if you could reduce up to 80% of your reflux symptoms not by changing your diet, but simply by changing the way you lie down? Most people don't realize they're sleeping in a position that actively encourages acid to rise. They think resting flat is neutral, natural, but in reality, it's like laying down on a slope, only the slope goes the wrong way. And every drop of acid that builds in your stomach during digestion suddenly finds a straight path to your throat. And you don't feel it until it's too late. The real question is, how many more nights will you ignore your body's cry for help? How many more mornings will you dismiss the signals that something is wrong? Because your body is trying to tell you something, not with loud alarms, but with whispers, burning whispers, coughing whispers, bitter whispers, whispers that become stronger each night you sleep in the same position. And while you might think your sleep is deep, what's happening inside is a slow erosion, one that doesn't stop when you close your eyes, because the position you sleep in may be the most powerful medicine you're not taking, or the most dangerous mistake you're repeating. You've probably never questioned the way you sleep. After all, it's just sleep, something your body is supposed to do naturally, instinctively. But what if the very position that feels most comfortable is the one that's been betraying you all along? Let's talk about the two most common sleeping positions that seem harmless, but can silently worsen your reflux symptoms night after night: sleeping on your back and sleeping on your right side. Let's start with the back. Lying flat on your back might seem like the ideal posture, especially with a soft mattress and a good pillow. It feels balanced, neutral, restful. But inside your body, that position creates an open highway for acid to rise. Your stomach, filled with digestive acids, rests almost level with your esophagus. There's nothing holding the acid back. And when the lower esophageal sphincter, the muscle that's supposed to act as a lid, relaxes or weakens, as it often does with age or under pressure, gravity steps in and pulls the acid upward, straight into your throat. Now imagine this happening every night for months or years. Without the help of gravity to keep things in place, acid finds its way upward more easily. And since you're lying flat, the damage happens faster and lasts longer. Some people even develop laryngitis or chronic sore throat just from sleeping this way, never realizing the source isn't viral, but positional. But it gets worse when you sleep on your right side. That might sound surprising. Why would one side of the body be worse than the other? It has everything to do with anatomy. Your stomach is shaped like a curved pouch, and the esophagus enters at the top, a bit toward the right. When you lie on your right side, the stomach curves downward, creating a funnel-like angle that encourages acid to pool near the esophageal opening. In other words, you're sleeping in a way that tilts your stomach toward your throat. On the outside, you're peaceful, but inside, acid is gathering strength, pooling closer to your esophagus, getting ready to push upward. One patient described it this way: "I used to fall asleep on my right side every night. I had no idea that was the worst thing I could do. I kept waking up with a sore throat and coughing fits. I thought I had allergies. After switching to the left side, it was like my body stopped attacking me at night." That single change, just turning to the other side, made the difference between waking up hoarse and waking up rested. Now let's pause here and reflect. Millions of people are treating reflux with pills, dietary changes, or lifestyle shifts, but very few are told that their sleep position could be the real cause of their suffering. And the reason is simple. Doctors focus on daytime symptoms. They don't always ask how you sleep. They don't always explain how reflux behaves differently when you're lying down. And most people don't connect the dots between how they feel in the morning and how they were positioned through the night. So we continue in ignorance. We eat early, avoid spicy food, chew antacids, raise our pillows, and still suffer because we're doing everything right, except sleeping the right way. Now let's imagine two scenarios. In the first, a woman in her 60s has been struggling with a persistent dry cough. Her doctors prescribed everything: cough suppressant, inhalers, even nasal sprays. Nothing worked. One night, out of frustration, she searched online and discovered that sleeping on her right side could worsen reflux symptoms. She switched to her left side, and within a week, her cough improved by 70%. No medications, no special diets, just a new sleeping position. In the second, a man in his 50s started experiencing chest tightness at night. He thought it was his heart. After several tests, his doctor confirmed it wasn't cardiac. It was acid reflux reaching his throat and pressing on his vocal cords. He had been sleeping flat on his back for decades. No one ever told him that was a problem. He bought a wedge pillow and started sleeping on his left side with a slight incline. His symptoms almost disappeared. These aren't rare cases. They're happening everywhere. And still, the conversation around sleep position is nearly absent from most reflux discussion. Now, why is the left side so different? It comes down to how your stomach and esophagus are positioned in your body. When you lie on your left side, gravity works in your favor. The stomach stays below the esophagus, and the acid settles toward the lower curve, away from the opening. It's a natural containment system, your own anatomy helping you stay protected while you rest. There's even research to back this up. A study in the Journal of Clinical Gastroenterology found that people who slept on their left side had significantly fewer and shorter episodes of acid reflux compared to those who slept on their right side. Another study published in the American Journal of Gastroenterology confirmed that reflux episodes were more frequent and lasted longer when people slept on their right side. But here's the catch. Most people naturally favor one side without thinking. It's a habit formed over years. Maybe your pillow feels better that way. Maybe your partner lies on the left side of the bed, so you naturally turn the other way. Maybe you're just used to curling up to the right. But that habit, however innocent, might be doing you more harm than you ever imagined. So how do you break it? Start by being intentional. When you get into bed, make a conscious choice to lie on your left side. Place a small pillow behind your back to keep you from rolling over in your sleep. Some people even sew a small tennis ball into the right side of their pajama top to prevent turning. It sounds silly, but it works. You can also experiment with a body pillow that supports your upper arm and leg, keeping your torso in a stable side position. The goal is comfort, yes, but also consistency. Your body can adapt. In just a few nights, most people begin to favor the left side naturally, especially when they start waking up without that burning throat or nagging cough. This is not about perfection. You don't have to spend 8 hours motionless on your left side. Even partial adjustments can make a big difference. What matters is awareness and the commitment to give your body the advantage it needs to heal. Because every night you spend in the wrong position is a night your body has to fight without tools. And every night you sleep in the right position is a step toward repair. Sleep isn't just rest, it's restoration. And the way you position yourself during those hours can be the difference between healing or slow, silent harm. Let's take a deeper look into what happens when you add elevation to this equation. Because lying on your left side is powerful, but it becomes even more effective when you understand the role of incline and gravity. Now that you understand the silent damage caused by the wrong sleeping position and how simply turning to your left side can already create a natural shield against acid, it's time to take the next step in protecting your body during the night. Because while position matters, elevation changes everything. It's easy to think that lying flat is normal, even ideal. We've been taught from childhood to sleep on soft beds with fluffy pillows, maybe even stack 1 or 2 pillows if we want extra support. But here's the harsh truth. A soft pillow under your head doesn't stop acid from rising. In fact, in many cases, it makes things worse. That's because elevation needs to happen from the waist up, not just the neck. When only your head is elevated, the body is forced into an awkward curve. Your stomach remains low, and your throat is still in danger. But when you elevate your upper torso, shoulders, chest, and head, gravity becomes your ally. And gravity, when you're dealing with acid reflux, is your strongest natural defense. Imagine a simple ramp. If your bed is the ramp and your stomach is the source of the acid, then the direction of the slope determines whether the acid rises or stays put. If your body lies completely flat or bends awkwardly because of pillow stacking, acid will follow its natural path, upward. But if your upper body is inclined, even just a few inches, the acid is far less likely to climb. You don't need a hospital bed to make this work. Some people use wedge pillows, those triangular supports designed to elevate the upper body by 6 to 8 inches. Others place sturdy blocks or risers under the legs of their bed frame to create a subtle incline across the entire surface. Even a few inches can significantly reduce the frequency and intensity of nighttime reflux episodes. One of the most compelling studies on this was published in the Journal of Gastroenterology and Hepatology, where researchers found that patients who slept with a 20 centimeters elevation at the head of their bed experienced dramatically fewer nighttime reflux episodes compared to those who slept flat. The incline didn't just reduce symptoms, it improved quality of sleep, reduced morning throat irritation, and helped protect the esophagus from long-term damage. Let's make this real. Picture a man in his 70s who has been living with reflux for over a decade. He's tried it all: low-acid diets, medication, eating early, avoiding coffee. Nothing seemed to stop the morning cough or the bitter taste that greeted him with the sunrise. One day, his granddaughter mentioned that her own doctor told her to sleep on a wedge pillow for reflux. Skeptical but exhausted, he tried it. Within 3 nights, he noticed a difference. He no longer woke up with a sore throat. The cough faded. And for the first time in years, he slept through the night. This isn't magic. It's anatomy working in your favor. When you elevate your torso, you tilt your stomach downward and your esophagus upward. It's like gently closing the door on the acid instead of leaving it wide open. And this change doesn't just help with reflux. It can also improve sleep apnea, snoring, and even sinus congestion, because elevation promotes better breathing and less pressure on your airway. That's why some sleep experts refer to inclined sleeping as a multi-purpose sleep therapy, because it addresses multiple nighttime problems with one simple, non-invasive shift. But there's a crucial detail here. How you elevate matters just as much as if you elevate. Stacking pillows might seem like the easiest solution, but it often backfires. Why? Because stacked pillows collapse under your weight or shift during the night, causing your neck to bend unnaturally. This not only reduces the effectiveness of the incline, but also puts strain on your cervical spine, leading to neck pain, headaches, and even worsened reflux in some cases due to compression of the stomach area. Instead, structured support, like a foam wedge, adjustable bed frame, or incline bed risers, provides consistent elevation without shifting. It keeps your upper body at a stable angle, allowing gravity to do its job throughout the night. If you're new to inclined sleeping, it might feel strange at first. Some people describe it as sleeping on a gentle slope, while others need a few nights to fully adjust. But your body adapts quickly, especially when it starts waking up without that awful tightness in your throat or the constant need to clear your voice. It's also important to pair this elevation with the correct sleep position, as we discussed earlier. Sleeping on your left side, elevated, is the gold standard. It's the 1-2 punch that gives your body the best possible conditions to rest, heal, and stay protected. This combination, left side plus torso elevation, reduces reflux pressure, minimizes acid contact with the esophagus, and protects the throat and vocal cords. It's not just a comfort trick. It's a long-term protective measure. Think of it this way. If you knew your home was slowly flooding every night, would you just mop the floor in the morning? Or would you fix the slope that's letting water in? Elevation is that slope correction. It doesn't replace medication if you need it, and it doesn't mean diet no longer matters, but it gives your body a chance to work with gravity instead of against it. And here's another insight few people consider. When you sleep inclined, your digestion also improves. The body naturally processes food better when you're not lying flat. Many people report less bloating, fewer nighttime bathroom trips, and even better circulation when sleeping on an incline. All of this adds up to one powerful realization: how you sleep is as important as what you eat when it comes to managing reflux. But there's still one hidden piece we haven't talked about. A set of symptoms that people often overlook or misdiagnose. They appear subtle at first, a little cough here, a raspy voice there, but they may be your body's early warning signs of deeper, silent damage. Signs that something is happening every night, without your permission, and possibly without your awareness. So what exactly is your body trying to tell you when you sleep? And are you listening? You wake up with a dry cough. Maybe it's just 1 or 2 times, maybe it lingers. You sit up, clear your throat, sip some water, and go on with your day. It doesn't seem like a big deal, just a tickle. But tomorrow it happens again, and the day after that. And slowly, without realizing it, your mornings become a routine of throat clearing, bitter taste, hoarseness, and a quiet frustration that you can't quite explain. This isn't just aging. It's not dust in the air or sleeping with your mouth open. These subtle signs are your body's alarm system. They are soft but persistent warning, telling you something has been happening in the dark every single night. Let's break it down. When stomach acid rises during sleep, especially if you're lying flat or on your right side, it can travel farther than you think. Not just up the esophagus, but into your throat, your vocal cords, even as far as your sinuses and lungs. This condition is often referred to as laryngopharyngeal reflux or silent reflux, and it's far more common than most people realize, especially among people over the age of 50. What makes silent reflux so dangerous is precisely its silence. There's no fiery heartburn, no chest pain that sets off alarms. Instead, it erodes quietly, bit by bit. It disguises itself as a cough, a sore throat, post-nasal drip, trouble swallowing, or a voice that cracks for no reason. Imagine this. A woman in her 60s begins losing her voice after talking on the phone for just 5 minutes. She thinks it's her age, or maybe allergies. But in reality, the acid creeping up her throat every night has been irritating her vocal cords, drying them out, inflaming the tissue. Now her body is trying to protect itself by limiting her voice use, by making her hoarse. It's not weakness, it's defense. Another example: a man in his 50s who has begun waking up gasping, panicked, unable to breathe for a moment. His doctor says it's probably sleep apnea, and he's scheduled for a sleep study. But during the night, what's actually happening is that acid has traveled into his airway, triggering a laryngospasm, a sudden closure of the vocal cords that causes a feeling of choking or suffocation. Scary? Yes, but common? Far more than you think. And then there's the bitter taste, that strange, metallic or sour flavor in the back of your throat in the morning. You didn't eat anything strange. You brushed your teeth. So why is it there? Because while you slept, acid was present. It rose silently, coated your throat, irritated the sensitive tissues of your mouth, and left behind a chemical residue your tongue could taste. But your brain never noticed until it was too late. These symptoms are often ignored or misdiagnosed. You might be told you have allergies, post-nasal drip, or even asthma. But the truth is, your body has been under nightly attack from within, and every morning it shows you the signs. Let's look at some of the most common ones. Chronic cough, especially in the morning, frequent throat clearing, or a feeling of something stuck, hoarseness or voice fatigue, a sour or bitter taste in the mouth upon waking up, choking, coughing, or with shortness of breath, excessive saliva or dry mouth in the morning, sensation of a lump in the throat, globus sensation. Individually, these might seem unrelated, but together they paint a very clear picture of reflux, specifically nighttime reflux that is escaping detection because it's not showing up in the typical ways. No burning chest, no fire after eating, just slow, creeping damage that appears in the most delicate places: the throat, the airway, the voice. Now here's something most people don't know. Your vocal cords are incredibly sensitive to acid. They're not designed to handle stomach contents, not even small amounts. Just a few drops of acid, exposed repeatedly, can cause significant inflammation, scarring, and long-term voice changes. That's why singers, speakers, teachers, and anyone who uses their voice professionally are at high risk when reflux is left unchecked. But it's not just about voice, it's about airway health. When acid reaches the respiratory tract, it can trigger asthma attacks, cause chronic bronchitis, or even contribute to pneumonia in older adults due to aspiration. And because many of these patients never feel typical reflux symptoms, they're never treated correctly. In fact, one clinical study found that over 40% of patients with chronic cough actually had reflux as the underlying cause. Not postnasal drip, not an infection, reflux. And many of them had no idea, because their reflux wasn't painful, it was silent. So how do you know if this is happening to you? One powerful clue is the timing of your symptoms. Do you wake up with a cough that gets better as the day goes on? Do you feel throat tightness in the morning, but not at night? Do you struggle with your voice only after waking up, but it improves by lunchtime? These are all signs that your sleeping position, elevation, and internal pressure are causing acid to reach your throat while you sleep. And remember, damage from silent reflux isn't always immediate. It builds over time. A little irritation here, a swollen vocal cord there, a sore throat that never seems to heal. Eventually, the tissue begins to change. In some cases, prolonged exposure to acid can cause Barrett's esophagus, a precancerous condition where the lining of the esophagus transforms due to chronic inflammation. But the good news is that this damage is often reversible, if caught early. That's why awareness matters, and that's why your nighttime habits play such a crucial role. You don't have to live in fear of every tickle in your throat or every raspy word. You just need to become your own investigator. Pay attention to your mornings, track your symptoms, and start connecting the dots between how you feel when you wake up and how you sleep through the night. So what can you do, starting tonight, to protect your throat, your lungs, your voice, and your peace of mind? The answer lies not only in your position or your elevation, but also in a few simple behavioral changes that can make your nights safer and your mornings stronger. Because the final piece of this puzzle isn't just about where you sleep, but when, how, and what you do before you close your eyes. By now, it's clear that the way you sleep can either protect you or quietly harm you. Your position, your elevation, and the hidden symptoms you experience each morning all work together to tell a story. A story that, for many, ends in frustration, confusion, or even unnecessary medication. But there's one final piece that brings it all together. A simple, powerful truth that too often gets ignored. Reflux doesn't begin when you lie down. It begins before that, sometimes hours before. And what you do in those hours can determine whether you sleep in peace or wake up coughing. Let's start with timing. One of the most overlooked yet impactful changes you can make is controlling when you eat your last meal. Most people finish dinner and head to bed within a couple of hours. Seems harmless, but digestion is a slow, meticulous process. When you lie down too soon after eating, your stomach is still full, active, and pressurized. That pressure pushes against the lower esophageal sphincter, the small muscular ring that's supposed to stay shut between the stomach and esophagus. But under pressure, especially when you recline, it weakens, it leaks, and reflux begins. Experts recommend waiting at least 3 hours after eating before lying down. That means if you finish dinner at 7 p.m., Don't go to bed before 10. Give your stomach time to break down food, settle the acid, and begin the process of emptying itself naturally. It's not just about discomfort. It's about reducing the volume and pressure that drive acid up the wrong path. And it's not just meals. Even small snacks, especially late-night ones, can be the silent trigger. A handful of cookies, a glass of milk, a bowl of cereal. Many of these seem innocent, but they activate acid production, stimulate the digestive system, and restart the cycle that leads to reflux. Then there's the question of what you're eating. Some foods are well-known reflux triggers. You've probably heard about avoiding spicy dishes, citrus, tomato sauces, caffeine, and chocolate. But did you know that even peppermint, a common ingredient in herbal teas or breath mints, can relax the esophageal sphincter and encourage acid to rise? Or that high-fat meals like creamy pastas, fried foods, or rich desserts slow down digestion so much that they increase acid production and make your stomach linger in work mode for hours longer? The goal before bed isn't just to feel full, it's to help your body wind down. That means light, low-acid, easy-to-digest meals in the evening. Think grilled vegetables, a piece of chicken, brown rice, or oatmeal. Not heavy casseroles, thick sauces, or red meat. Let's take a closer look at a typical routine. A man in his late 60s used to eat dinner around 8 p.m. His favorite meal? Pasta with tomato sauce, garlic bread, and a glass of red wine. By 9:30, he'd settle into bed with a book, then fall asleep on his back around 10. Every morning, he woke up with burning in his throat, coughing fits, and sometimes even chest tightness. He thought it was just indigestion or maybe the wine. But once he changed his habits, eating by 6:30, switching to lighter food, skipping the wine, and sleeping on his left side with a wedge pillow, everything changed. His symptoms didn't just improve, they disappeared. For the first time in years, he woke up feeling rested, without coughing, without fear. Another simple but powerful habit? Chewing slowly and thoroughly. Sounds too basic, right? But when you chew well, you break food down more efficiently. That reduces the amount of work your stomach has to do and shortens digestion time. It also mixes food with saliva, which has natural acid-neutralizing properties. The slower you eat, the better your digestion, and the lower your risk of acid backup. Even posture after eating makes a difference. How often do you finish dinner and slump on the couch, or lie down to watch TV, or recline in a comfortable chair? Sitting upright after meals isn't just good manners, it's protective. Remaining vertical for at least an hour allows gravity to assist in digestion. It helps food move downward, not upward. And for those especially sensitive to reflux, a gentle walk after dinner, just 10 to 15 minutes, can do wonders. It stimulates digestion, reduces pressure, and improves blood flow. Some people even go a step further by wearing looser clothing in the evening. Tight waistbands, belts, or shapewear can increase abdominal pressure and push stomach contents upward, especially when sitting or lying down. Comfort isn't just about feeling relaxed. It's about relieving pressure in the places that matter most. Now, you may be wondering about medication. Should you rely on antacids or proton pump inhibitors, PPIs? Are they safe? Are they enough? The truth is, medications can help, especially in the short term or in severe cases. But they don't fix the root cause. They reduce acid, but they don't change pressure. They don't elevate your bed. They don't flip you onto your left side. They don't time your dinner or control your habits. In other words, they're a tool, not a cure. And many long-term users of PPIs report that when they stop taking them, their symptoms come back stronger. That's because the body adapts. And once you remove the chemical control, the pressure still exists, unchanged, unmanaged, unchallenged. That's why lifestyle matters. It's the only sustainable, side-effect-free solution that empowers your body instead of masking its alarms. So what does it all come down to? A few core principles. Simple, yet powerful. Eat light at night, and eat early. Avoid known triggers like tomato, citrus, caffeine, chocolate, alcohol, and high-fat foods. Chew thoroughly and eat slowly. Sit upright after meals or take a short walk. Wear loose-fitting clothing to reduce pressure. Elevate your upper body when you sleep, 6 to 8 inches if possible. Always sleep on your left side. Each of these steps, on their own, can make a difference, but together, they form a shield, a daily practice that transforms your night into a healing space rather than a battlefield. Because reflux doesn't have to define your nights. It doesn't have to steal your mornings, your energy, your voice, or your peace. Once you understand the mechanics of your own body, how pressure, gravity, timing, and positioning all interact, you take back control. And in the end, that's what this is about. Not just managing symptoms, but reclaiming your rest. So tonight, before you lie down, pause for a moment. Think about your last meal, your position, your elevation, your routine. Then ask yourself one simple question. Is my body working for me tonight or against me? Because the answer may change the way you sleep forever.